Hi, my name is Rick Davis. I'm one of the physicians who care for people here at the Michael D. Wachtel Cancer Center at Mercy Medical Center. I'm a radiation oncologist. The treatment machine that we've recently decided to acquire is called a Varian TrueBeam linear accelerator, and it has been receiving all sorts of awards around the world for being a revolutionary and dramatic improvement over previous designs and capabilities of treatment machines. The machine itself incorporates a CT scanner into the machine so that it can take a CT scan immediately before treatment, and then we can adjust the treatment position or the treatment fields onto the patient with very high levels of accuracy. This will allow treatments to be performed much faster, which is much more comfortable for our patients. They don't want to sit on a treatment table for any longer than they have to. The treatment fields will actually wrap right around the tumors and stay off of critical organs around them. So we will be able to do stereotactic radiosurgery and SBRT treatments that were previously not available to the people of Oshkosh. It's very important with cancer patients that we be able to deliver the needed treatment closer to home, that they not be put in a position where they have to travel to get their treatments. And it's been situations that will likely most benefit from the new technology. One of them is patients with cancers of the head and neck. The cancers of the head and neck typically involve some part of the inside of the mouth or the throat, somewhere down into the voice box maybe, and it can spread to area lymph nodes. In order to cure this cancer, we usually use a combination of chemotherapy and radiation therapy. But when you're doing the radiation therapy, it's very important to have the radiation field at a high dose to kill the cancer. But you also have to be very careful that when you deliver that radiation, that you stay off of critical surrounding structures. The spinal cord is right in the back, and it does not like high levels of radiation. If you want to preserve swallowing functions, you have to strictly limit how much dose goes to the larynx itself. If you want to prevent dry mouth that could exist for the rest of that patient's life, you need to try to limit the dose that goes to the parotid glands. The hearing mechanisms, the visual apparatus, all these things are things that don't like high doses of radiation. And when you get these very accurate studies with CT scans and MRI scans and PET scans and combine them with a very elite treatment machine like this, it does a very good job of killing the cancer without hurting the patient and giving them long-term side effects from the therapy. So the other is with brain metastases, or small tumors that can spread from other places in the body into the brain. Sometimes you get a small tumor that is next to critical structures that don't like high doses of radiation. And because of that, it's very important to make a very tight field with a high dose of radiation and have it drop quickly off in its dose so that very little surrounding brain gets any radiation of a dose that could hurt it, and that you stay off of critical surrounding structures. Again, this sort of technology, these sort of tools weren't really available 10 years ago. And as we have seen that a significant advantage is available to the patients in acquiring this technology, it's been a commitment from the administration of the hospital to acquire the technology so that it will be available for the patients here in the Michael Wachtel Cancer Center.